So blood pressure gives us a reflection of exactly what it sounds like, the pressure within our blood system. So you've got the heart, which pumps. You've got, call it the plumbing, all the blood vessels that go out of the heart, go to all of our organs and our tissues, our skin and everything else that needs providing blood. And then the pipes that bring it back again. So blood pressure tells us what the pressure is within that system, within the blood vessels themselves. The top number gives us an idea of roughly what the pressure is when the heart beats, because the pressure jumps up a little bit then. And in between heartbeats, the lower number gives us an idea of what the resting pressure is in the blood vessels. So the historic way that we've always diagnosed blood pressure is try and get it measured on 3 separate days. Okay, so lots of options these days. You could do that. Gold standard is to do it at home, okay, in your most relaxed environment. You can do it with your pharmacist, you can do it at your GP surgery with a nurse or a healthcare assistant, or however the system's set up where you are. And the way it's diagnosed is, now, for somebody with no medical conditions and generally fit and well otherwise, okay, 140 systolic, the top number, and 90 diastolic, the bottom number. Now, when you have medical conditions like diabetes, we'd like to aim a little bit lower, but as a general guide, that's the general threshold that we work to. So 4 main factors that influence blood pressure. So the amount that we exercise, our body weight, our salt intake, and one of the biggest culprits is alcohol, how much alcohol we consume, because that can increase your blood pressure as well. Those are the 4 big factors. Reduce your weight, your blood pressure will come down. Increase your exercise, increase the intensity of your exercise, your blood pressure should come down. A lot of people now, they're actually quite good. People are conscious of salt intake, so they try to minimize it. A lot of the salt intake actually seems to be an issue when it's in processed foods that we buy from the supermarket. So you get people that aren't having any added salt in the diet at all. They're very good with their cooking. They make sure they don't add it at the table, but they're buying a lot of food and getting a lot of food that is causing them to take in a lot of salt on an ongoing basis. And then alcohol, the more alcohol that you take in per week, the more, you're likely to have, blood pressure impacted by that and the blood pressure drifting up. Uncontrolled blood pressure has numerous risks. It's probably the most difficult risk factor in terms of our chances of having a stroke or a heart attack. If your blood pressure is uncontrolled, the pressure in the system's higher, you're more likely to have something called a hemorrhagic stroke, where you actually burst a blood vessel in the brain because the pressure is too high. In terms of uncontrolled blood pressure, it actually damages the blood vessels as well, so then it makes a rupture more likely. Okay, for different reasons, it also causes potential issues with our chances of actually developing weaknesses in our system as we go on. So your heart, your brain system, the blood supply in your brain. So both of those things can cause an issue. So the average person, under the age of 40, as long as you're having a blood pressure check every 5 years or so, that's normally okay. If you've got a family history of different conditions and there's a little bit of a concern, particularly earlier in life, then you might want to be doing it every 1 or 2 years just to be safe. Doesn't take much effort. You can pop into your pharmacy or keep a blood pressure machine at home and do that. When you've been diagnosed with higher blood pressure, obviously you need to keep a closer eye on it. So, you're already at a stage where your blood pressure's gone to a higher level. Changes are more likely, drifting upwards is more likely. If you're having to take medication, sometimes we need to keep an eye on how well that's working. So you'd normally say at the minimum, your practice will want to have checked your blood pressure every year just to make sure it's within the normal range. If it comes back high, they'll want to keep a closer eye on it and maybe do things to get it back in the normal range again. So this is really important. You can easily end up over-diagnosing people, and for people to end up more likely to get unnecessary treatment if we're not being accurate about how we measure blood pressure. Now, I normally send my patients a text message so that they don't have to remember all of this, so that they've got an opportunity to just review this. Ideally, you need to have been sitting down. Now, as I've mentioned before, you ideally want to do this at home in your most relaxed environment. That's where your blood pressure is liable to be closest to its natural level. So ideally do it at home. Ideally do it when you've been sitting for at least 5 minutes. Don't do it when you're stressed. Don't do it if you're in pain. Don't do it if you're actively feeling unwell. In all of those situations, your blood pressure is likely to record higher than the natural level. Make sure you've been to the bathroom, front end and back end. And when you do the readings, record the third reading, ideally. Okay. So generally with machines, the blood pressure tends to record a little bit higher on the first reading, settles a little bit on the second one, and then by the time the third one, everything seems to have calmed down a little bit. It's just one of those quirks when we do people's blood pressure. So that's what we'd recommend. Now, if you take blood pressure medication, what's really important is two things to remember. Let's say, for example, you take your blood pressure medication at 7 o'clock every morning. Now, in the last few hours before you take it, bear in mind yesterday's dose is almost 24 hours since you took it. It's likely to have started reducing in effect. Your blood pressure is likely to have started to drift up. That obviously depends on what your physical system's like, which medication you're taking, and numerous other factors. So that won't be the same for everybody. But also when you take your medication in the morning, it takes 2 to 3 hours for it to get to full effect. Again, medications vary somewhat quicker than others. And even the same medication, if you took 10 completely different people, different ages, shapes, sizes, they wouldn't all necessarily absorb it at the same time. So for that reason, it's always better, I normally tell my patients, try and avoid checking your blood pressure 3 hours before you take your medication and 3 hours after. If you're a morning blood pressure medication taker, try and go for the afternoon or evening, because you're likely to get a more reliable reading, just in view of the way your medication and the blood pressure itself might vary.